Welcome to this RESYST webinar on demonstrating research impact. My name is Rebecca Wolfe and I'm the Research Uptake Manager for RESYST, which aims to enhance the resilience and responsiveness of health systems to promote health and to reduce poverty. So in this webinar, I'm going to show the approach that we have developed to track, measure and describe the impact of our research on policy and practice. I'm going to start the session by giving an overview of research impact, what it is, including some of the different types of impact, and the challenges of demonstrating impact. And then I'm going to introduce RESYST's approach to demonstrating impact, from planning for impact at the start of the research, to tracking and monitoring outcomes, and then to describing impact using our research impact framework. And at the end, I'm going to show some examples of RESYST impact stories that we have developed. So what is impact? Research Councils UK defines impact as the demonstrable contribution that excellent research makes to the economy and society. So it distinguishes between academic impacts and non-academic impacts. Academic impacts include new knowledge and scientific advancement, the development of new research methodologies, techniques, or cross-disciplinary approaches, or training skilled researchers. And non-academic impacts, on the other hand, can include improvements to society or the environment, for example, enhancing health and well-being through better access to health care, or contributing towards the economy through wealth creation, or contributing to evidence-based policymaking and increasing the effectiveness of public services and policy. So whilst researchers are used to tracking academic impacts, for example through citations, there's increasing pressure to demonstrate the non-academic impacts. Why is it important for researchers to demonstrate the non-academic impacts of their work? This quote from DFID explains why from a funder's perspective. It says we need to demonstrate that research is reducing poverty not only to the taxpayers but also to the countries we work in. So funders like DFID are increasingly looking for evidence of impact to demonstrate the value of the research and to justify the public funding of research. In the UK, impact is now part of the Research Excellence Framework, which is a national exercise conducted every 5 years to determine the allocation of public funding for university research. So it's also important to demonstrate impact to qualify for future funding. And finally, in public health research, it can be argued that research should have an ultimate goal to make a real difference. At the London School, our mission is to improve health and health equity in the UK and worldwide, and it's simply not enough to focus only on publishing research journals. There are multiple and often overlapping types of impact. The Economic and Social Research Council distinguished between 3 different types of impact, focusing on the different ways that research is used. So instrumental impact is when research findings directly influence the development of policy or service provision or government legislation or regulation. Conceptual impacts occur when research contributes to the understanding of policy issues or debates, for example, leading to increased public awareness of an issue or a change in attitudes. And capacity building impacts refer to technical and personal skill development. The ESRC also identify other types of intermediate impacts, including culture change, for example, where stakeholders view research as more useful than they had previously thought in the past, and also enduring connectivity, where stakeholders are willing to develop new relationships with researchers. Another way to consider different types of impact is to look at the effects of the research on different levels of government, or in RESYST's case, of the health system. So at the national or global level, impact might be about changing attitudes of policy and decision makers to influence national strategies and plans. And at the health facility and worker level, impacts may be more about how health policies are implemented on the ground and how services are delivered. It's also worth thinking about what these impacts ultimately lead to, improved patient health, for example, or care practices, or increased efficiency in the delivery of health services, or raised public awareness. But of course, there are, however, many challenges to demonstrating the impact of research. Impacts don't necessarily happen immediately, and they often occur years after the research is conducted, yet there is demand for us to demonstrate impacts before the end of the research project. The pathways that research influences policy are linear and iterative, and impacts can also be unanticipated. And all of these factors make it difficult to track impacts and to describe them in a narrative. Impacts are also difficult to measure, which is why we use indicators, which I will discuss later in the presentation. Another challenge of demonstrating impact is improving the contribution of the research and actually getting evidence that it has been used. This is especially the case if the kind of impact is conceptual, for instance, changing a policymaker's understanding of an issue, which can be very difficult to prove. And another challenge is in how to demonstrate the impact of negative findings that don't necessarily lead to change, but are important nonetheless. So with all these challenges in mind, we at RESYST have spent a lot of time and effort developing an approach to demonstrating the impact of our work. This has involved planning for impact right at the start of the project and putting in place the building blocks to maximise impact at a later date, such as identifying policy relevant research questions and building relationships with stakeholders. Researchers have worked hard to embed themselves within the policy processes in their countries, and in many cases have become trusted sources of formal and informal advice. Our theory of change has also helped to plan for impact, which I will show in a minute in more detail. Next in our approach is tracking the impact of RESYST outputs and activities. We use several indicators to monitor the reach and use of the research and collect evidence of this as it happens. And finally, we use a research impact framework to describe the impact of our work. This process mainly involves tracing backwards from identifying an impact and identifying what outputs and engagements have led to this impact. The research impact framework has been particularly useful in helping us to develop impact stories, which I will show at the end. So starting with planning for impact, theory of change is one approach that is increasingly being used by research projects to design and plan for and evaluate the impact of their research. A theory of change maps out the expected pathways of change between a project's activities and its intended impact, whilst taking into account different contextual factors that might influence change. This is a participatory process that requires the whole team to think about the change they want to see at the beginning of the research and ongoing reflection and critical thinking about how change happens. Anticipated pathways of change are made explicit as assumptions and tested using indicators. This is RESYST's theory of change. Our intended impact is to contribute to policy and management changes that enhance the resilience and responsiveness of health systems in low and middle income countries. This long-term goal was the starting point for developing a theory of change framework and a process of mapping backwards and considering what outcomes and then outputs and then activities are needed to reach the goal and what needs to be in place for each of these to happen. So activities include aligning research plans and questions with national priorities and conducting high-quality research activities. And outputs include innovative research with policy-relevant messages and recommendations, outputs that are available and accessible to different stakeholder groups. We distinguish between short-term outcomes, such as key stakeholders being aware and supportive of RESYST research and strengthened relationships with policymakers. And in our long-term outcomes, the research informs policy and management decisions in member countries and at the international level. These are the indicators we use to track whether or not we are on course to reach our outcomes. For journal publications, we monitor article citations using Google Scholar. To track how many people have read the article, we count downloads from our website. And we also monitor journals' own article metrics, which show the total number of views or accesses that a publication has had through their website. This box on the left-hand side shows article metrics for an article published in a Biomed Central journal, and it includes the total number of accesses and the number of citations by other BMC publications, and also the article's altmetric score. We also track views of RESYST presentations on SlideShare. So on the right-hand side of the screen, you can see a SlideShare insight summary for one of our presentations. And this contains information about the total number of views or actions as well. This includes likes or embeds of the presentation to another website, and also the trends and views and the top countries where the article was viewed from. We monitor how many people use our website using Google Analytics, and we count the number of clicks from our Twitter account through Bitly. We also use altmetric to track the online presence of our journal publications. Altmetric is a tool that collects and collates any information about a research output that is available online into a single package. This box shows an altmetric page for one of our journal publications. And on the left-hand side, it shows the number of mentions it's had on Twitter and the number of readers on Mendeley. But it also puts the publication in context by comparing it with similar outputs. For example, it shows the article here ranks 95th out of 381 outputs from the journal it was published in. We also keep a record through our intranet of stakeholder engagements, such as meetings with policymakers, participation on advisory committees or presentations at conferences, and requests that researchers get for consultancy or advice by policymakers. This is an indicator that researchers are viewed as a trusted and high-quality source of information. Each of these records enables us to build a picture of the type of relationships that researchers have with policymakers and how the research is being used. Of course, it is important to collect evidence of impact, and this is almost always easier done during the project than retrospectively. This chart shows some of the different kinds of evidence that can be used. One of the most common types of evidence used to prove impact is testimonials. For example, a personal account, a letter, or an email that mentions the impact of the research. Other examples include a reference in a policy or government report or in implementation guidelines, media coverage about the research and its impact, such as a news story, an article, or a video, or a mention of the research in notes or minutes from a committee meeting. Finally, I move on to the final section of describing research impact. For this, I have developed a framework for researchers to use to think through the different types of research impacts, and then to describe the pathways of impact, making the links between research with outputs and outcomes and impact. The framework allows for a broad approach that can either be applied to one research project or to a collective body of research over several years. It does this by covering engagements that are both specific to the research, as well as those relating to the research, where research is part of a larger body of work. By thinking about the impacts first, the process being required of researchers is of tracing backwards and identifying what outputs and interactions led to the impact. There's also a space in the framework to highlight potential impacts of the research to accommodate for the short timescales demanded by funders. So going into more detail, the research impact framework has 3 sections. On the section on impacts, researchers are encouraged to think through the different types of impact that the research has had, such as instrumental or conceptual or capacity building impacts, and to document evidence of these impacts. And then also to describe the potential wider impacts of the research that haven't necessarily happened yet. The next section on engagement with research users records interactions with policymakers or practitioners that relate specifically to the research, as well as interactions that are relevant to the research. It also records interactions with intermediaries, such as the media or NGOs. And for RESYST, a lot of this information is already recorded in our tracking activities, so it's a matter of sorting through this information and linking the engagement activities with the impacts. The third section of the framework provides background to the research, including its aim, relevance, and intended users, and the outputs from the research. So using this framework, here are some examples of impacts identified from RESYST research. In Nigeria, research is being used to influence debates and discussions about the implementation of the new National Health Act, and it was shared with the technical working group for the implementation of the Act, and the unit in the Ministry of Health that is responsible for planning universal health coverage. So we know that the research is being used because our researchers are actually members of the technical working group, and they're also close to policymakers in the unit. In a second example, research in Kenya has led to the development and use of new training tools for health planning and budgeting by Kilifi County health management teams, after researchers highlighted weaknesses in previous tools to planning department at the Ministry of Health. And thirdly, research in South Africa has been used by health policymakers to inform their new white paper for implementing the National Health Insurance Policy, and RESYST research is cited several times in the policy document. A final but essential step in demonstrating research impact is telling the story of the impact to funders or the general public or to the subjects of the research. The research impact framework has been a useful tool in preparing a narrative, as it provides a basic structure for talking about the research and how it was used. The background section also helps by providing context and a definition of the research, including why it is important. Impact stories can be told in many different ways. They might be short written case studies that can be included in a report, or a series of photos or a video interview to go on a website. What is important is that they are appropriate for the intended audience. For RESYST, the intended audience of our impact stories is primarily our funder, DFIDs, and the general public using our website. Research funders have quite different characteristics from researchers, as shown in this table. Whilst researchers have a vast knowledge of the subject they are studying, our funders are not necessarily specialists in the field, and they may have less knowledge of the research methods, but be very knowledgeable of real-world contexts. Funders also have less time to spend on the subject. So for us, the aim has been to produce clear, concise, accessible outputs that can be easily absorbed or read. This one-page case study tells the story of how RESYST researchers from the Health Policy Research Group at the University of Nigeria have been playing a role in shaping Nigeria's plans for universal health coverage. This is a graphic I have produced that maps the diverse influence of RESYST researchers based at Kemri Wellcome Trust at both the county and national levels in Kenya. The purpose of the graphic is to show the embeddedness of researchers across many different areas of policy and practice, both formally through membership on policy committees and working groups, and also informally by giving advice and support to policymakers with whom they have relationships. The graphic groups the type of stakeholder influenced, such as political actors or development partners, and it shows the type of influence by the different lines around the boxes. The graphic also links to short 2-minute video stories where researchers explain how their work has contributed to policy discussions and decisions. So in conclusion, demonstrating research impact is a necessary component of many research projects, and it is likely to become a greater requirement for funders. There are several challenges in demonstrating impact, especially given the long time frames that impact can take to happen, which is often longer than that of a research project. RESYST has developed an approach to demonstrating impact that maximises our chances of impact from the start, that actively tracks the use of our outputs, and that traces backwards to identify links between research activities, outputs, outcomes, and impacts. Finally, there are many different ways of telling impact stories, and it's important to keep in mind who they are for when planning the content and type of output. Many thanks for listening to this presentation. If you would like a copy of the framework or of the theory of change, please email me, and my address is on the slide at the moment. A final thing that I'd like to say is that if you visit our website in the next few weeks, we'll soon be having a section on the site that's actually dedicated to impact, and that's where our impact stories will be hosted. So if you'd like to see them in more detail, then please do visit our website.
Hi, Rebecca. Can I ask a question?
Sure.
Yeah, I'm Sangeeta from the RESYST Consortium, and I was just wondering when you decide that an impact story is good enough for public viewing, uh, when you decide to put it on the website?
Yes, well, we hope to share all of our impact stories. We're just doing the website developments at the moment so we can share them, and because we're using different different types of output, so we do have some videos and we have some graphics. We want to make sure that our website can host all of these different outputs, so we will be sharing them all. The process of deciding what is an impact and when it should be reported on is discussed with researchers. This last year it was done at the annual meeting where people sat down and thought through some of the impacts and discussed them there.
So once your impact story is documented for the funder, then you sit together and decide whether it's worth sharing with the audience outside.
Yes, and for us, we would all. I think I can't think of an example where we wouldn't share a story with the general public. I realise that there are occasions where the type of impact may be more private, and then you might share with. It might be more appropriate to share with the funder in a report, but not on the website.
Mm-hmm.
So I suppose that's thinking through and discussing with the researchers when it's appropriate to just share with the funder or to share with the public.
Okay, and would you change the format to suit the audience? You were saying about tailor making it to suit the audience. So, and you showed us a template of a case study, and then you showed us an infographic, and then of course a video.
Yeah.
Are there any other modes of transferring impact stories on the website that you use, or are there any other platforms you use?
No, another one that we're thinking of doing is telling the stories through blogs. Researchers can write about their experiences of having an impact as a personal blog story, which we would put on our website. That would be more for the users of our website, for the general public, rather than for our funders. But what we might do is to also report on it slightly differently in our annual report to our funders. So what we'd have one impact. We might tell the story in a couple of different ways.
Okay, thank you.
Thank you, Sangeeta. Greer asked the question, do we have to share the stories first with funders before publishing them on the website? No, we haven't, Greer. The timing of it is that we will be sharing it with our fund. We probably will share it with our funders first because the website is just taking a few weeks longer to finish than we had planned. The most important thing about sharing the stories is making sure that the researchers are happy this is accurate and we have evidence of the impact. And I think if we have that, then we'd be happy to share it on our website, but making sure that we have an accurate story and that we can back up what we're saying with evidence. So Michelle's asking me to explain instrumental and conceptual impact. So what I'm going to do, Michelle, is I'm going to flick back to the slide that goes through the different types of impacts. The way I think of it is instrumental impact is the most straightforward, basic type of impact that you think of when you think about research influencing policy. Unfortunately, it never really happens like that, where a piece of research happens and then the findings are relevant and they take it to the policymaker and the policymaker says, okay, I will change this policy or write this policy. That's instrumental use of research. It's the kind of assumption that everyone has about how research influences policy. Unfortunately, that is rarely the case. Usually it's a lot more complicated and convoluted than that. And research, when researchers talk about it with policymakers, it may just be that they understand the issue slightly differently as a result of the research. So it doesn't automatically lead into a policy change, but it might alter their opinion, which in the future will change their how they would write a policy. But it's a lot more vague, and that's what I would consider conceptual impacts or conceptual use of research to be. It's about increasing awareness of an issue, or having better understanding or changing attitudes, but not necessarily directly changing policy. It's more of a step in the way to changing policy, whereas instrumental is much more direct. Does that make sense and answer your question, Michelle? Great. Okay, great. Thank you then. I will end the meeting unless I have any more quick questions. But as I said, please visit our website or please email me if you have any other questions. And thank you very much.